The Medicare for All proposal has also been picking up quite a bit of steam, it sounds like, or traction within the Democratic Party. What's your opinion of that proposal?
Yeah, so I think the Democrats' push for Medicare for all is good, but it also has its own challenges and difficulties. I think what's important to think about when we talk about Medicare for all is that I think everyone, regardless of how they want to get there, all agree that, at least, well, not everyone, I guess Democrats agree that healthcare should be a right and it should be accessible and affordable to everyone. But like how we do that is really the question. And there's a bunch of proposals and thoughts on how we get there. Obviously, Medicare for all is a big policy out there right now. During the ACA, obviously the ACA was a huge step in that direction, and even during that debate, there was a discussion of how do we include a public option to even provide coverage to more people and make it more affordable. Right now, you have Medicare for all. You have maybe a Medicare buy-in or even a Medicaid buy-in, policy proposals. So I think there's a lot of options, and it's good that folks are thinking about it right now, right? I think what we don't want to do is just say, hey, this is the only thing that works. This is how we should go, and the party should only get behind this option. Because there's still a lot of unanswered questions of what a Medicare for all plan looks like. What does a benefit package look like, right? Because Medicare right now is a program for seniors, so it doesn't really necessarily cover things that might be important for kids, right? So we need to think about how do we build that program, or how do we build that kind of benefit, and is it really going to be just a government-run program, or will it be a mix? Like Medicare Advantage is a government program, but it's operated by private insurance. What are the reimbursement rates that we're going to set for doctors, hospitals, and services like visits and pharmaceuticals and all that kind of stuff? What are individuals going to be paying in terms of cost sharing or deductibles? Like these are all just important questions. Not to say that we don't have answers or a Medicare for all plan can't address any of those, but it's really just things that we need to have answers for before we kind of just say jump all in and say this is how we're going to do it.